Hello everyone, welcome to another Upgrade Your OET vocabulary quiz with me, Sona. We're going to be looking at teething today and the vocabulary fretful and dribbling, and we're also going to be looking at a speaking roleplay. This session is designed especially for pharmacists, but don't worry if you're not a pharmacist, it's going to be useful for everyone because we're going to be looking at that all-important everyday lay language. I know that you as healthcare professionals know your subject inside out, but how can you communicate that to your patients? And that's one of the key criteria that the OET is looking for. We're going to be looking at some questions that you can use in your OET speaking roleplay, or that you may hear in the OET listening. Remember, listening part A of the OET includes listening to general healthcare consultations. This could well be with a pharmacist, and you may hear something like this come up. If you do want to find something more particular to your own profession, then take a look at our other videos, which include special speaking role plays for nurses and doctors as well, or you can have a look at our reading or writing sessions. So we have lots of lessons for you to check out. Just have a look, you'll be able to see the links popping up somewhere right now. And if you like these videos, don't forget to click on that like button, share it with a friend or colleague, and subscribe to us. Okay, now this is the situation I'd like you to have a look at. What do you think is wrong? So what's actually happened to the patient, or the patient's baby in this case, and what would you say if a patient comes to you with this problem? So a mother or a father comes to you and says, "My 4-year-old has a temperature. He's fretful and dribbling a lot. Is he ill? Can I give him children's paracetamol?" So we've got two words here, fretful and dribbling. What do they mean? And what do you think is wrong? How would you respond in this situation? So 30 seconds to think about the meaning and think about how you can reply. Here we go. Okay, so fretful and dribbling then, first of all. Well, it's obviously something about the baby, and fretful means being worried or unhappy, especially because they're nervous or tired. So it's this idea that something isn't quite right. The baby, of course, can't describe this, but they are fretful. They appear worried or uncomfortable or unhappy. And dribbling, if you dribble, is saliva. So the liquid in your mouth is coming out and it's coming out onto your chin. Now that's obviously not uncommon for children, but in this case the mother or the father is worried because the baby is dribbling a lot, and the mother is worried that the baby is ill. So I think we can probably assume that the baby is teething, is obviously getting their first teeth. So how can you reply? Is the baby ill? Well, actually, the baby's just teething. So what advice could you give? Now, I'm not a healthcare professional. I'm an English teacher with over 15 years experience, and I'm also a premium preparation provider of the OET. So all my medical knowledge comes from reputable sources, and in this case it's the NHS, and I'll put the link at the bottom here, and I'll also put it in the information box so you can check it out as well, and see what they recommend. So let's see what they say. We're going to be focusing on some pronunciation as we go through the vocabulary here. So some babies are born with their first teeth already, and others start teething when they're about 4 months old or even after 12 months old, but mostly around 6 months. The symptoms, and sometimes the teeth emerge with no pain, no discomfort. It's all lovely. But at other times, the baby's gum is sore, gum, sore, and red where the tooth is coming out. They might have a mild temperature, as the parent has indicated to you. They have one flushed cheek. So if they have a flushed cheek, the cheek is red. They might have a rash on their face, or they might be rubbing their ear. They might be pulling their ear. They're dribbling more than usual, dribbling. So that's the word we looked at. They're gnawing and chewing on things a lot. Just note this G, it's silent, gnawing. That's kind of that nom 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 idea when they're trying to chew on something. They're more fretful than usual. And of course, that's the word we had a look at before as well. Uncomfortable. And they're not sleeping well. So these are the typical symptoms. And what advice can you give them? Well, you could advise the parent to buy a teething ring. Teething ring. And that's that kind of ring that the baby can chew on safely. And it might ease their discomfort and distract them. These rings can be cooled in the fridge because it has a nice cooling effect to soothe the baby's gums, and there'll be instructions which tell the parent what to do. It's important that they don't put this ring in the freezer because it could damage your baby's gums, and also not to tie the ring to the baby's neck because this could be a choking hazard. Choking hazard. This could mean that they choke, so it's very dangerous. In terms of pain relief, well, you can advise the parents to give them a sugar-free pain-killing medicine, such as paracetamol or ibuprofen, especially for babies. If the baby's over 3 months old, they shouldn't have aspirin, and you should always follow the advice that's written on the package, and obviously talk to the GP or pharmacist. And then the parent can comfort the baby as well by playing with them or rubbing their gums with a clean finger. And maybe you want to give them some advice about preventing rashes. So just rub away any of that dribble from their face. Okay, so that's the advice from the NHS. Now here is a role play for you. It's set in a suburban pharmacy, as I say, it's specially designed for pharmacists, but you can still look at this even if you're not a pharmacist. Think about what you would say, practice those skills of gathering information and giving information, etc. But first of all, 3 minutes to read through and plan. Here we go. Okay, so the patient has come to you with their little boy and they're worried because, as we said, the boy has a fever of 38 degrees and they want some advice about why the baby is dribbling and it's flushed. Your tasks are to find out the problem, onset symptoms, baby's behaviour. Remember, take away anything too technical or too medical, so we need to change onset into something more accessible. You know the symptoms now, already had a look at them in the previous part, so we can talk about those. And we need to ask further questions to check if the baby is teething, for example, displaying signs of pain and discomfort, gum discomfort, or unusual behaviour. So how can you convert this? How can you translate this into everyday lay language? You could start by saying something like, okay, let me ask you some more questions so we can find the best treatment for your baby. So you've started off by signalling, by signposting to the parent that they've given you this information, but you want to ask more questions. Why do you want to ask more questions? It's so that you can give the baby the best treatment possible. Onset, you can translate to when did you notice the problem? And then you can ask about the symptoms, which we've already had a look at. Is the baby flushed on one cheek? Are they dribbling more often? Etc., etc. Then you need to reassure the parent that it doesn't sound like anything serious and it's more likely that the baby is teething. So be nice and reassuring. From what you've told me, it doesn't seem serious, but actually it sounds as though your baby is teething. You then need to explain that teething presents differently in different babies. As we looked at before, it could range from babies could already have teeth to over a year old before they first appear. So commonly around 6 months, but it's quite possible that they emerge at 4 months, and then advise the parent to buy a teething ring. And of course, we spoke about this already, it's really important that they don't tie the ring to the neck and they don't freeze the ring. So we need to really give them advice and then signal these things because they're really important. Well, each child is different, but what you can do is buy a teething ring, but make sure you don't. So that's the key, that's the trigger to give the advice. Make sure you don't tie the ring to the baby's neck because that could be a choking hazard, but you can cool the ring in the fridge but not in the freezer. The patient is obviously going to ask something there, the carer, and the next step is to tell the parent that there is a lack of advice that teething gels work and advise them to try the ring in the first instance, and then paracetamol is fine as well, as long as they follow the guidance. So again, think about what is too technical, what do you need to translate? Something like administer, that's far too technical. You need to put that into lay language and then give them some additional information. Actually, there isn't much evidence that teething gels work, but instead try the paracetamol. If the baby's in a lot of pain, just follow that advice on the package. And also another thing you can do is try and distract the baby. So play with him, rub his gum with a clean finger. So we need to put this A in here. They often leave out articles in the role play, so make sure you put those back in. If you want to practice this with a friend or a colleague, here is the patient's roleplay or the carer's roleplay card. So just take a screenshot of that and practice, see how you get along and let me know. I hope you found this useful. Thanks again for watching. Don't leave us just yet. Why not watch one of our other videos right now? Take care and see you again next time. Bye bye.